Come in.
Good morning. My name is Makia, and I'm one of the nurses working with your provider. I was asked to come in and speak with you about your diagnosis of human immunodeficiency virus, HIV. Is that okay with you?
Sure, I'd like that.
I'd like to begin by asking you if you can tell me what you know about this disease.
I know that this isn't good.
Okay, let's begin with a more clarified description of diagnosis. HIV is an RNA retroviral infection that is transmitted from person to person and most often through sexual and blood contact. HIV interferes with the immune system to coordinate an effective response against infection. Loss of that immune function may take years to occur, eventually leading to the stage of a disease called acquired immune deficiency syndrome. At this stage, patients become more vulnerable to opportunistic infections. Before we go any further, what questions do you have for me so far?
The results right now are that I am HIV positive. My immunity is now compromised, making me more susceptible to getting sick. And with that, the disease may progress. How do I keep that from happening?
Okay, seems like you have some understanding of this disease. And are you ready to move on to the medication regimen?
Yes.
So, to keep that disease from progressing, with your readiness for treatment and preparedness for medication adherence, there are medications and alternative therapies to treating HIV, and which are antiretroviral therapy drugs. They slow the progression of HIV. The goal of the medication is to decrease the viral load, prevent HIV-related symptoms and opportunistic diseases, and prevent HIV transmission.
This sounds intense. So there are meds that will help slow down the changes with HIV? What, no medicinal therapies?
Oh yes, there are some non-medicinal therapies if you choose not to take the ART meds, such as nutritional support to maintain lean body mass and ensure appropriate levels of vitamins, eliminating drug and alcohol and tobacco use, exercise and rest, decreasing your stress levels, keeping up to date with vaccines, keeping up with your provider appointments, and avoid exposure to new infectious diseases. Can you tell me what you understood so far?
I have options of treatment, medicinal and alternative therapies, a strict medication adherence practice that will help slow the disease, and some other routes such as keeping up with MD appointments, getting vaccines, and eliminating alcohol.